Well, this morning we're bringing to light the need to care for those with dementia and Alzheimer's. That's because it's actually Older Americans Month. Joining us now is Dr. Macie Smith, a licensed gerontologist. Good morning, Dr. Smith.
Good morning, Friendy. How are you?
Good. First of all, some people might be wondering, what is a gerontologist?
Yes, that's an excellent question. I get that asked all the time. And so I tell folks, when you think of gerontol, what do you think of? The older adult population. And so I'm a licensed social worker and gerontologist, so I focus a lot of my efforts on the older adult population, not only the older adult population, but also their families and their family caregivers.
You know, so talking about the older, we could say generation we're focusing on now, what do the numbers show in South Carolina as it deals with having to care for individuals with dementia, Alzheimer's?
What we're looking at in South Carolina, a little over 300,000 family caregivers are providing unpaid care for an adult or a senior with a chronic illness or an adult with a disability.
That's a lot.
It is a lot, but when we break that down to focus on Alzheimer's and dementia, we're looking at approximately worldwide 16 million family caregivers providing care for someone with Alzheimer's. They're not getting paid.
So how can we properly care for someone with Alzheimer's or dementia?
Well, that's an excellent question because I get that all the time. The medication actually does not treat the disease, which the #1 type is Alzheimer's that causes dementia. There's vascular dementia, there's frontotemporal dementia, there's dementia with Lewy bodies. And so since the medication does not treat the actual disease, I actually self-published a book that's a medley of frequently asked questions that family caregivers who are living with dementia have asked me over the years, over the 10 years I've been doing it. And so the key is when the medication doesn't work, then there's caring for the person and caring for the soul of the person.
Absolutely. So this is a book that you were talking about, a dementia caregiver's guide to care.
Yes.
How about the caregiver? You talk about this in your book.
Right. What happens is, and why this book was so important to publish and actually get out during Older Americans Month, is we find that approximately 40% of family caregivers, they actually pass away before the person who has the chronic illness because they're not caring for themselves.
Oh, wow.
When we think about dementia, Friendy, that's a cognitive impairment, so it affects a person's ability to process, to reason, and to remember. And that often frustrates the caregiver, so they try to force change, inevitable change. And so what we try to do is help them communicate and engage better. And that's what the book talks about. What to say, how to say it, when to say it, what your body language should look like, because as those brain cells are deteriorating, folks who have a progressive form of dementia, they're having difficulty comprehending what you're saying, but they're focusing on what you're doing and how you look while you're doing it.
Wow, a lot of great information, especially in this book and what you're sharing with us this morning. So really quick, we have about 20 more seconds left. Where can people go to get in contact with you?
They can contact me at info@dtconsultant.org. The book is available on Amazon or on my website. It's bookdrmacie.com.
All right, Dr. Macie Smith, thank you so much for being here this morning.
Thank you,
We appreciate
Friendy.
all you're doing. Absolutely. Folks, stay with us. There's more Good Day Columbia coming up after the break.